Hello everyone, today we're going to be talking about neck CT with and without contrast.
A neck C+C- is a CT scan which examines the soft tissues of the neck. It can be ordered to evaluate the cervical spine as well. This scan images the orbits through the top of the lungs and is used to assess neck glands and lymph nodes in detail. A CT scan of the neck can be performed in two ways, with either using contrast or without contrast. The image on the right is a CT scan of the neck using contrast, and the image on the left is a CT scan of the neck without the use of contrast. A neck C+ scan is performed by utilizing IV contrast material in order to extensively detect masses, abscesses, and complications of neoplastic and infectious conditions. The advantages of this type of scan are that the contrast material enhances the visibility of structures and it makes it easier to identify diseases. Some disadvantages are that the exam time is long and contrast agents can pose potential side effects to patients. For this type of exam, a non-ionic contrast is administered through the means of an IV bore which is present in the antecubital fossa. In the duration of 48 hours, there should only be one CT contrast study that is scheduled. Within 72 hours of the CT scan, BUN and creatinine should be performed. The night before the scan, only clear liquid should be consumed after midnight and nothing else. 4 hours before the exam, no food or drink is to be consumed. For a CT scan of the neck without contrast, this is done when identifying small foreign bodies. Using a contrast agent will distort the appearance of the foreign body, and so it is best to not utilize a contrast agent when needing to identify foreign bodies. So the advantages of this type of scan is that the exam time is shorter and foreign bodies are easily identified. Some disadvantages are that the image isn't as detailed and therefore an accurate diagnosis of the disease cannot be done.
So when is a neck CT scan ordered? The most common reason a neck CT scan is ordered is to check for potential injuries after an accident and to look for signs of an infection such as an abscess, a birth defect, cysts, or other tumors. A neck CT may also be recommended when planning for neck surgery, radiation therapy, or a biopsy. Other indications for a neck CT scan include, but are not limited to, lumps, neck mass, vocal cord paralysis, foreign body in the neck or upper airway, birth defects of the cervical spine, head or neck cancer, parotid or submandibular gland lesion, pharyngeal or tonsillar abscess, tongue mass or lesion, or pre-existing bone conditions such as osteoporosis and arthritis. For a usual neck CT, an IV iodinated contrast may be used for an accurate diagnosis. However, the need for the IV contrast is determined by the reason for the scan.
Some pathologies of the neck for which a CT scan is done are thyroid cancer and vocal cord paralysis. Thyroid cancer is a cancer of the thyroid gland, and this occurs when there is an alteration to the DNA that is contained inside of the thyroid cells. This alteration leads to uncontrolled cell growth, creating a lump. Goiter, family history, acromegaly, and exposure to radiation in childhood increase one's risk of developing this cancer. This type of cancer is very common in people who are in their 30s and people over the age of 60. Thyroid cancer is more prevalent in women than it is in men. Common symptoms are a lump in front of the neck, swollen glands, persistent sore throat, and trouble swallowing. Vocal cord paralysis. This occurs when the nerve impulses directed to the larynx are disturbed. Vocal cord paralysis impacts one's speaking and breathing ability. Some causes of this disease are injuries to the neck and chest, stroke, infections, and tumors. Some common symptoms are noisy breathing, hoarseness, loss of vocal pitch, loss of gag reflex, and ineffective coughing. Having a chest or throat surgery and a specific neurological condition such as Parkinson's disease all increase one's risk of developing this disease.
Tonsillitis is another pathology of the neck. Tonsillitis is an infection of your tonsils, which are two masses of tissue at the back of your throat. It is most often caused by common viruses, but bacterial infections can also be the cause. Tonsils act as filters, trapping germs that could otherwise enter your airway and cause infection. They also make antibodies to fight infection. But sometimes, when they get overwhelmed by bacteria or viruses, which can make them swollen and inflamed. Retropharyngeal abscess is another pathology of the neck. It is an accumulation of pus posterior to the pharynx. It is usually caused by a bacterial infection, and the diagnosis is based on symptoms such as pain or difficulty with swallowing, a stiff neck, noisy breathing, and in order to confirm the diagnosis, a CT of the neck is done.
Is any imaging done prior to CT? For any pathologies of the neck, CT scans are the most common imaging modality. CT scans are conducted first before any other imaging exams to examine neck conditions. This is primarily because CT scans are readily available, have quick exam times, and image lesions and bony structures in extensive detail. However, that being said, there are other imaging exams done that are done alongside CT scans for further investigations of neck conditions. Some other imaging exams that are done alongside CT for evaluating neck conditions are MRI scans and ultrasounds. MRI scans provide the most comprehensive detail of soft tissue structures in the neck. They are mainly done for imaging tumors in the neck and for evaluating sinusitis complications. A main advantage that MRI scans have over CT is the improved quality of soft tissue structures. CT doesn't image soft tissue as well. Another advantage is that MRI doesn't use ionizing radiation, unlike CT, which makes it more safe for the patient. A disadvantage is that exam times are longer and there's an increased need for the patient to comply. Ultrasounds are useful for imaging salivary glands and the thyroid gland. Ultrasound is considered the gold standard for thyroid nodules. Some advantages of ultrasound is that they are of low cost, they're readily available, they have short exam times, and there's no exposure to ionizing radiation. A disadvantage to ultrasound is that they're greatly dependent on the technologies. An advancement in diagnostic CT is PET-CT, also known as positron emission tomography. This is a functional imaging method that incorporates radioactive substances such as radiotracers for the purpose of measuring and visualizing alterations in metabolic processes. PET-CTs are performed when detecting tumors that are recurrent. It allows for the identification of primary tumors in patients who have cervical node metastases. PET-CT scans are the primary way of diagnosing neck squamous cell carcinomas. When compared to CT and MRIs, CT and MRIs both provide information about the extent of the primary tumor. However, PET-CTs are more advanced as they play a significant role in characterizing local, regional, and distant disease, which cannot be done by CT and MRI. And this image is showing neck squamous cell cancers, which are diagnosed by conducting a PET-CT scan. Another advancement is MDCT, which is known as multi-detector computed tomography. MDCT is an improved form of CT which utilizes a 2D array of detector elements. With this imaging technique, we can distinguish amongst benign and malignant tumors in the neck. This imaging method allows for assessing bone infiltration of various structures. The bone window/soft tissue setting permits for bone infiltration. The contrast medium used for these scans substantially improves the sensitivity of the lesions being imaged. This imaging technique differs from CT as CT only consists of one row of detectors. Since MDCT has multiple rows, multiple scans can be taken at once. This makes the exam time much shorter in comparison to regular CT scans. MDCT also has fewer motion artifacts. The slices are thin, which lessens radiation exposure, making it more safe for the patient. 400 milligrams of iodine are used for a neck CT. Since such a high concentrated contrast is used for this scan, there is also a 5 to 10% increased contrast between the normal and the pathological tissue, which enhances the visibility and it makes it easier to identify any diseases.
A SPECT scan, or single photon emission computed tomography, is another advancement in diagnostic CT. SPECT images are taken after an injection of a nuclear medicine radiopharmaceutical. The injected medication sticks to specific areas in the body depending on what the radiopharmaceutical is used for and the type of scan being carried out. For example, it can show bone in a bone scan and gallbladder and bile ducts in a hepatobiliary scan. The radiopharmaceutical is detected by nuclear medicine gamma cameras. The camera or cameras rotate over a 360-degree arc around the patient, allowing for images to be reconstructed in 3 dimensions. While imaging tests such as X-rays can show what the structures inside your body look like, a SPECT scan produces images that show how your organs work. For instance, a SPECT scan can show how blood flows to your heart or what areas of your brain are more active or less active. For patients suffering from severe neck pain, a SPECT scan can provide the best diagnosis as CT and MRI findings are inconclusive for pain generators. SPECT scans are very useful for identifying pain-producing generators in the cervical spine. Angiography is another advancement in diagnostic CT. Just a few years ago, an angiography, which is an examination of the blood vessels, could only be done by inserting a catheter into an artery. This procedure had use of contrast and could take up to several hours, and it would often require a sedative. It also had risks involved like blood clots or bleeding. However, in a CT angiography, the doctor just injects the contrast material into the arm and takes a CT scan. The arteries in the lung, kidneys, brain, and legs can then be examined. The whole process just takes 10 to 25 minutes, and it's safer, faster, and cheaper than the traditional way. CT angiography also has high specificity and high sensitivity for coronary artery disease. It is also used to detect vascular pathologies in the neck, such as blocked neck arteries. CT angiography can also provide information on where there is narrowing in the carotid arteries. Future of neck CT. Dual energy CT was something that we found was a very recent development in CT. It is also known as spectral CT, and it is a type of CT technique that uses 2 separate X-ray photon energy spectra. Essentially, it is called a virtual non-calcium technique, but it uses the interrogation of materials that have different attenuation properties at different energies, whereas conventional single energy CT only produces a single image set. The dual energy CT can be used to reconstruct various different types of images, such as weighted images, virtual monoenergetic images, and material decomposition images. It can also remove bone, and it can reconstruct 3D images and therefore generates images with a lot better quality. For this reason, it is also really beneficial for musculoskeletal radiography. However, there are some disadvantages to this technique. It is known to produce material artifacts sometimes, and it also causes errors with segmentation. Another type of technique that we found to be the future of neck CT was flash CT. The flash CT scanner features 2 X-ray beams, yet it minimizes a patient's exposure to radiation and the time for testing. For example, a traditional CT scan of the chest cavity usually takes about 15 seconds to complete. The flash CT of the chest cavity only lasts about 0.6 seconds, and it captures images of the heart in less than half of a heartbeat, and it exposes the patient to much less radiation. This is also really great for people that have a hard time staying still for a longer time, or people that have a harder time holding their breath, specifically children and trauma patients. While traditional scanners are generally safe and appropriate for patients who require scans less often, the flash CT is also designed for patients with chronic medical conditions who require very frequent CT images, and therefore it's really time efficient when compared to the standard CT. It's quiz time! We will be asking you 5 questions, and the answer to those questions are going to be on the next slide. And here are all the answers to the questions on the previous slide. And that is the end to our presentation. Thank you so much for listening, and if you have any questions, you can ask them below and we will try to answer them as soon as possible. Thank you.